Hi, this is Patrick Horn, president of GAP. Thank you to our sponsor, Johnson & Johnson, for the support of this medication review video module.
Hi, I'm Peter Byrne, a nurse practitioner based out of Lone Tree, Colorado with South Denver Gastroenterology. And today I'll be speaking on the safety of Guselkumab in ulcerative colitis and Crohn's disease. I'll start with ulcerative colitis first. So this was studied in a trial titled Quasar. It was a phase 3 double-blind parallel group multi-center randomized placebo-controlled trial, which enrolled 701 patients who had had an inadequate response to or could not tolerate conventional and or advanced therapies. Patients were required to have a modified Mayo score of 5 to 9, a rectal bleeding score of 1 or lower, and an endoscopy subscore no higher than 2. And patients were randomized in a 3-to-2 fashion to receive IV Guselkumab 200 milligrams or placebo at weeks 0, 4, and 8. The rates of serious adverse events were 2.9% in Guselkumab and 7.1% in placebo. The adverse events leading to discontinuation were 1.7% in Guselkumab and 3.9% in placebo. Approximately 15 to 16% of patients in each arm experienced an infection of any grade, with serious infection rates of less than 1% in each arm. Adverse events within 1 hour of infusion were observed in only 1.4% of patients treated with Guselkumab, none of which were considered serious. No new safety signals were seen in the maintenance trial when compared to the induction trial, and the safety data was consistent with the known safety profile of Guselkumab observed in patients with plaque psoriasis and psoriatic arthritis. Moving on to the safety of Guselkumab in Crohn's disease. So this was studied in the Galaxy 1 trial, which was a phase 2 double-blind placebo-controlled study, randomizing patients in a 1-to-1-to-1-to-1-to-1 fashion to receive either IV Guselkumab 200 milligrams, 600 milligrams, 1,200 milligrams at weeks 0, 4, and 8, or IV Ustekinumab at week 0, followed by a 90 milligram subcutaneous dose at week 8, or placebo. Of the 360 patients, the proportion of patients with one or more adverse events through week 12 was similar across the treatment groups. The rates of infections were 21.4% in placebo, 15.1% in Guselkumab, and 12.7% in Ustekinumab. The rates of serious adverse events were 5.7% in placebo, 3.7% in Guselkumab, and 5.6% in Ustekinumab. One serious adverse event I did want to highlight with the Guselkumab group was a single event of toxic hepatitis, which was reported in a 44-year-old female who received Guselkumab infusion, followed by a single 200 milligram subcutaneous dose at week 12. Her liver tests at baseline and through week 8 were normal. After week 8, she developed an acute GI illness. It should be noted that multiple family members were also ill with similar symptoms at that point. Her lab test at week 12 revealed marked ALT and AST elevations 10 to 15 times the upper normal limit, with a slightly elevated alkaline phosphatase. She was subsequently hospitalized and treated with IV prednisolone, fluids, and cholestyramine. An extensive diagnostic evaluation did not reveal a clear etiology. She recovered. LFTs normalized after 3 months. She stopped treatment and was discontinued from the study. The rates of serious infections were 0% in placebo, along with 1.4% in both Guselkumab and Ustekinumab. There were 3 serious infections occurring in the Guselkumab group, including 1 event of viral gastroenteritis, 1 event of an enterovesical fistula, and 1 event of an anal abscess. All 3 were investigated and determined not to be related to the study drug. In the induction trial, there were no serious hypersensitivity reactions, no deaths, no cases of active TB or opportunistic infections. In the maintenance phase, among the patients treated with Guselkumab or Ustekinumab, the most frequently reported infections up to week 48 were nasopharyngitis, occurring in 11% of patients, and upper respiratory infections occurring in 6% of patients. After week 12, 2 Guselkumab-treated patients had serious infections. No active tuberculosis, opportunistic infections, or deaths occurred. And for any additional information, please visit the GAP website.